Hi everyone. Welcome back to our series of podcast जिसका नाम है MBBS की बात दिल से। तो पहले 2 एपिसोड्स में हमने ऑलरेडी 2 गेस्ट से डिस्कस किया था। तो एपिसोड नंबर 3 के लिए वी हैव मिस तमार परताया हु इज द डीन ऑफ कुतैसी यूनिवर्सिटी फैकल्टी ऑफ मेडिसिन। सो शी इज विद अस। तो कुछ सवाल हमारे व्यूअर्स और स्टूडेंट्स एंड पेरेंट्स के जरिए हमारे पास आए हैं। सो वील पुट फोर्थ द क्वेश्चंस टू हर and we'll see to it that we keep the conversation very candid. तो start करते हैं episode number 3 of MBBS की बात दिल से. Good to have you, ma'am, in our podcast. So to begin with, firstly, I would like to ask you to introduce to us about Kutaisi University.
Thank you, first of all. Thank you for inviting me. It's my just first visit in your podcast and wish you success.
Yeah.
I'm ready to answer all of your questions to fulfill your doubts and to start just speaking about our university.
All right.
It's pleasure for me to represent Kutaisi University. It is very old private university.
Okay.
It is more than 32 years old, and we are implementing the English language program at the medical faculty.
All
This
right.
is like medical doctors, yeah. Our university situates in the western part of Georgia.
Okay.
Which is itself very old city, Kutaisi, and the name itself of the university comes from the city name. Actually, it is very calm, like hospitable part and city itself, Kutaisi.
Yeah.
People love foreigners. There are a lot of Indians and not only Indian
And the international students.
Yeah. So they are just very easily adaptable for the students.
Ma'am, to talk about, especially Faculty of Medicine, if you could explain to us about the course structure, the duration of the course and syllabus of, MD Medicine course for Indian students.
Okay, I will try to follow all of your questions. Just
Yeah.
if I miss anything, just then remind
Yeah.
me. Yeah.
Yeah, sure.
Regarding the program itself, what we are just implementing at Faculty of Medicine, as I've already noted, it is English language one cycle medical educational program, medical doctor. The duration of the program is 6 years,
Okay.
and the amount of the program is 360 credits.
All right.
That means if the student would love to get the diploma and get the degree of the medical doctor, they have to cover these 360 credits, and they be available after this to gain this type of the degree. The tuition fee of the program is $4,000 USD per year. We are just giving also the students possibility to cover it per semester.
All right. So I think so around $4,000 makes Kutaisi University one of the most affordable options for medicine course in Georgia. To talk about, there are a lot of questions which our viewers and also parents ask, and it is with respect to medium of instruction. By medium of instruction, I mean in what language are international students taught MD medicine course?
As I already mentioned, the program of the medical doctor program is full English program. All the subjects, lecturers are English speakers, and the subjects what we are just implementing and are included in this program, the syllabi are all English language. and we are using all the international books, literature for teaching these subjects.
All right. There are, certain questions also asked with respect to learning Georgian language. Now, it is obviously very much evident that whichever international student comes to Georgia, so is Georgian language a part of the curriculum, and is it taught to international students?
Thank you for the question. This is really interesting and great to note. Georgian language is one of the important part in medical program itself, in English language medical program, as we are implementing it in Georgia. Yeah. So according to Georgian legislation, also it is mandatory for all the foreigners, foreign program students to study Georgian language during 2 years. This means 4 semesters. These are compulsory, but additionally, we are also offering our students in the 5th semester Georgian language as a communicative Georgian to speak like this. So this is practically the intermediate level when we are offering them this type of language. As you know, after 3rd year, they are moving to the clinic.
Yes.
And
So
anyways, but despite Georgian, as we are speaking regarding language, despite Georgian, we are offering also as a subject choices different languages, for example, French, Russian, German language.
And these options are given after the 4th semester, right? So 4 semesters of Georgian are compulsory, which is obviously required because they'll need to know Georgian in order to, just for basic communication with the patients.
Yeah, absolutely.
Like ma'am, you just mentioned about clinical rotations. So, a lot of parents and students are, quite inquisitive about what kind of clinical exposure do students get at Kutaisi University. So, if you could explain to us how many hospital affiliations and clinic affiliations does Kutaisi University have, and how are students, given clinical exposure?
Thank you for the questions. I will make a brief review that we have itself at Kutaisi University, at Faculty of Medicine, great simulation centers which are equipped with all modern technologies. We have laboratories also which are equipped with high technologies, with all the necessary equipment and exposures that students need for their laboratory work, for their studies. Practically all these equipments of these laboratories are enough not only for study, just and make your laboratory job, but to make the normal and ordinary practices. But this one thing is that simulation centers are one of the important part, because in the framework of this program of the medical doctor, we are giving students possibility to study clinical skills from very fast semester, very early stage. That means all the students have possibility to gain some of the knowledge regarding the medical field, medical experience, like even to check the blood pressure, pulse rate, and many others. We are using for these simulators different type of the mannequins, different medical exposures, and many things. Despite this fact, also we are using the simulation centers for exams, which is objective structured clinical examination, and this is one of the important points that we are following all the international regulations, what are recommended by WFME standards, and the As for the hospitals, which are practically our affiliated hospitals, we are collaborating nearly 15 hospitals. Our students also have a possibility to gain a great practice, to be trained there by the high qualified staff, doctors, make duties, rotations there, and attend different type of the surgeries or different operations.
During these clinical rotations, ma'am, under the supervision of a senior doctor, are students allowed to actually touch patients and perform any kind of activities, or it is just observation?
All the students who are now with us and are taking the rotations, all of them have great possibility and chance, and all of them can mention during the interview that they have chance to not only just observe and attend the operations, but to make the communication with patient, just to give take some kind of analysis and then speak about it. Practically, they are not making, and it is not allowed according to the legislation, and they are not even do not have the license to make independently any practically the operative insertion. But as they have a great chance to just spend all their spare time in the operation block, that is also the great
opportunity,
possibility for that opportunity.
Moving on, I remember when you visited India, you had spoken in one of our seminars about Erasmus program. So if you could just briefly talk about these exchange programs and how does it benefit the student, and also how does Kutaisi University help students in order to get into such programs?
We have great experience really in this field as well, because we are offering our students exchange programs. Practically, this is Erasmus Plus programs, which are funded by the European Union. Fully funded one. The student could have the chance to gain knowledge, to study abroad, practically getting also some the grants, that means scholarships, and also their living costs are covered in the process. And when we are just getting such kind of the offer from them, we are making the call, and our students, all of them, have opportunity to participate in this competition, and then we are making some kind of the interviews, and we are just choosing some of them, and all the students, Georgian and foreign students, have chance to take part in this exchange program, and we are always just encouraging them not to miss this opportunity and this chance.
I would like to inform all our viewers that Erasmus program is basically a program where an international student gets an opportunity to probably spend a semester in some other university, and this program is fully funded program, so you don't spend even a penny, and also get an opportunity to spend an entire semester and get a global exposure, which already ma'am mentioned. Moving on, ma'am, I would like to ask you about a lot of students who consider Georgia. They are very, very inquisitive and asked us about how does the programs, MD medicine programs in Georgia, and especially Kutaisi University, how can it help them in their preparation for USMLE and PLAB? And if any such students from Kutaisi University have cleared any step of labs and got any licenses done?
Practically, when we are speaking about USMLE and PLAB exams, it is worth mentioning that we have very important and fully funded book fund, which are sufficient not only for this program, but also for preparing for USMLE and PLAB and any international exams. Even for the Indian exam, for example, for the next exam, so all these books are free for our students. They have access and use them practically and practice for this. After fulfilling the program itself, they can and we can recommend for them also to train separately for international exams as well, but this exam itself are not included in the program. These are not included. This is not in the program part, but separately, of course, they
and
can.
I'm pretty sure, teachers are very, I think so, if any student approaches them,
even
obviously
the
they'll be very happy to help,
can
and
support,
guide students for preparation.
Teachers,
that is one thing actually which makes Georgia special, that teachers are very humble, and if at all a student approaches them, and they are ever ready to help students. Moving on, ma'am, many students and parents are always confused as to what degree is awarded to an graduate who completes MD medicine course. So if you could just clarify, like what is the nomenclature, or to speak of what is the final degree which is awarded. So is it MD medicine, degree awarded, or some other degree which is awarded after completion of 360 credits?
After fulfilling all these credits, students are granted with a medical degree, medical doctor degree, ND. So it is like practically the general degree, which gives them possibility to work even in clinic, in any hospital, as a junior doctor. But they do not have a specific specialty. Specific specialty. Under the supervision of the senior doctors, they can make their
my next question will be on junior doctor. A lot of students and parents are always confused about the term. Now, when we talk about junior doctor, I've gone through the WFME standards, and we've read it in detail, that not only students who complete from Georgia, but in fact all the students who complete the undergraduate degree are also termed as junior doctors in their respective countries. So I would also, the follow-up question will be, are local Georgian students and international students, once they complete MD medicine course or the medical doctor course, are both given the same term as junior doctors, ma'am?
All the students are equal for us, and the program, which are accredited by WFME standards and by the Quality Enhancement Center of the Georgian. Of course, all these gives the student one and the same and equal level of qualification, which is medical doctor. That means if you gain this diploma, all the students, no matter if he or she will be Georgian or Indian or any other nationality, they can use it as a junior doctor and work in the hospital under the supervision of
senior doctor. The follow-up question on to this will be, ma'am, that are all junior doctors, all graduates of medical doctor degree, do they have the right to practice medicine? And this obviously applies to both local Georgian and the international students. Are equal rights given to both? Can both local Georgian and international students practice medicine?
All of them have the equal rights, no matter of their nationality.
All right. So irrespective of the fact that whether they appear for a separate licensing exam, irrespective of the fact, they both have the right to practice medicine. So neither local Georgian students nor international students need to give a separate licensing exam to get a right to practice.
Nothing.
Yeah, because
only the exams, if they would love to take any specific type of the specialty,
then only.
In this case, they have to move to the residency, and this is separate part for this. For the specific field, if you are going to choose, for example, if you would love to choose pediatrics or OB/GYN or any other,
then only you need to appear for a separate licensing exam.
Yeah, only in this case they have to make the specific type of the exams and then make practice in hospital or clinic.
Yeah.
My
next question will be, like, since you have been handling Indian students for the past couple of years. So my question to you would be, how has your experience been with Indian students? And also, when you compare Indian students to other international students, what difference do you find between the two?
According to my experience, practically I have touched not only Indians but from different countries, like from Arabian countries, from Iraq, from Bangladesh, from UK. All the students are equal for us practically, and the Georgian students as well. If we start comparing with them, practically the Arabian students, the Iraqi students, we are quite rebellious, but the others, Indian students, are just behaving quite well there, and they try not to just make any mess or just misunderstanding between each other. So we are always just making meeting with them regarding orientation meetings, even from the beginning, and time by time per semesters I will try to meet with them, and we have some kind of the discussion regarding not only the studying but
regarding everything about safety, about a lot of
everything, extracurricular activities as well.
So probably even discussion about traffic rules, behavior outside, a lot of things.
A lot of things. Practically, they love just riding bikes.
This is for all Indian students.
It's very important to make some kind of the instructions with them in this field as well.
Correct. Before we end this podcast, ma'am, my final question to you would be, what message you would like to give to prospective students who would like to come and study MD medicine course at Kutaisi University? So what would be your message to them?
I will just call all the students, all the applicants practically, or just going to choose a medical doctor program, and if you already planned to come to Kutaisi University, you are welcome, and wish you success in your future study, and we practically guarantee you the high quality medical education and colorful student life.
Yes. So it was a pleasure to have the conversation with you. And before we end, I'd like to give some message in Hindi, which probably after we end the podcast, I'll translate to you and I'll give you that message as well. So ये एपिसोड नंबर 3 में हमारा जो डिस्कशन था वो मिस तमार के साथ था, जो है डीन ऑफ कुतैसी यूनिवर्सिटी. तो जो काफ़ी क्वेश्चंस जो हमें स्टूडेंट्स एंड पेरेंट्स के जरिए आते हैं, तो हमारा काम रहता है कि हम उसे पुट फोर्थ करके हर एक रिप्रेजेंटेटिव जो है यूनिवर्सिटी के, उनसे हम क्वेश्चंस पूछते हैं और उनके जवाब लेकर आप तक पहुंचाते हैं। तो मैं आशा करता हूं कि एपिसोड नंबर 3 इस पॉडकास्ट जो MBBS की बात दिल से है वो अच्छा रहा। एंड फिर भी अगर आपके मन में कुछ भी डाउट्स हो इस यूनिवर्सिटी को लेकर तो आप हमें सोशल मीडिया हैंडल्स के थ्रू कांटेक्ट कर सकते हैं। कुतैसी यूनिवर्सिटी इज one of the most affordable options for MBBS in Georgia। और अगर आप एडमिशन इस पर्टिकुलर यूनिवर्सिटी में ले सकते हैं तो आप एड्यूवाइजर को कांटेक्ट कर सकते हैं। तो चलिए इसी के साथ इस पॉडकास्ट को एंड करते हैं, फिर मिलेंगे एक नई शख्सियत एक नए पॉडकास्ट के साथ। जल्दी मिलते हैं हम अगले वीडियो में।